All right, so today the talk is on sleep. And I'm trying not to look at everybody's eyes and see if you're tired or not. But it's an unusual condition in that nobody knows why you go to sleep. What is it that makes you go to sleep? What makes you wake up? So we're going to go over a lot of those things today. But to just introduce everything to you, just so you know, we have a monthly special, which we do a lot of the times. But what we've done is we're going to give you 5 times the reward points on anything you buy.
On Holly Hill.
Oh, the Holly Hill, yes. For the month. It's not just today. So it's going to be a big month for us, and hopefully a big month for you. In your packets, I'm hoping we also put in our professional services. We have a lot of them. If you read this, there's some pretty interesting things going on here, including our new homeopath, Dr. Yura, who does a lot of homeopathic medicine. And it's a lot of fun. She has a whole different slant on things. So she's a good person also. While you're here, and whenever you're here, you might consider picking up some of our brochures. This trifold gives you a lot of information on what we do. Here's Anne. She's our muscle tester. She has a lot of unique things that she does. And then somebody saw this yesterday and said, "When is this guy in?" To me, said it. And I said, well, it is me, but it's after the accident and the reconstruction. So we got that out of the way. Also want you to be aware that we have a lot of great literature. And if you're not looking at the end caps where we hang these literature pieces, you really need to look at that. Some of those things might be exactly what you need to read. I'm hoping this one, because it's about anxiety, we'll be talking quite a bit about anxiety. All right, so I'm Dr. Phil Pappas, and I do a talk here a couple times a year. Maybe we'll do 3 this year, who knows. I'm here anyway on Saturdays. Might as well do the talk. But we're going to start, you see the title, Natural Interventions for Sleep Problems. It's not just supplements we're going to be talking about. We're going to be talking about stress, anxiety, and other reasons that you might not be able to sleep. I think we'll just go to the first slide. Sleep disorders. They're conditions that affect quality. When I say quality, how good your sleep is, amount, your length of sleep, and timing of sleep. We're built to sleep when it's dark and work when it's light. Now, when you hear people say things like, I'm a night person, they're literally going against our physiology. They're like challenging our hormonal selves. And that can lead to more and more sleep disorders. And many of you might know that I used to be at Abingdon Hospital for many years. And we used to study our own nurses. And the reason we studied our own nurses is the Farmington study, which is a nationwide study of nurses and their health issues. And of course, we wanted to see what our nurses were going through. And I think maybe we actually contributed data to these type of studies and all. We didn't have an actual study of our own. But one thing I found out very quickly is the night shift nurses, just like in the Farmington study, always have more health problems. The full spectrum of health problems. Things you wouldn't even think about with sleep or cycle issues. That's what we're talking about here. Timing of sleep. Nurses work 3 shifts in most places, and at least in hospital setting. And the morning shift nurses are pretty healthy compared to the night shift nurses. The in-between ones, not bad, but the night shift people really take a beating. So when you hear people say, I'm on night shift this week, even worse, because they're going to have to adjust next week back to another one. This is like tearing you up. And I think, let's just go to the next slide. This is where your sleep, daytime distress comes from poor sleep. You're really tired. How do you feel? Not so good. And impaired functioning. It can get pretty dangerous driving a car or a truck if you haven't had enough sleep. I call that impaired, and it should be. There are many types of sleep disorders, and we're going to just go through them very quickly. Insomnia, difficulty falling asleep. Doesn't explain the issue, it's just a condition by name. So there's a lot of reasons for insomnia. I put up there sleep hygiene, stress, that type of thing. Sleep apnea, a medical condition that really needs to be treated by a physician who knows what they're doing, some type of sleep doctor. We had a sleep center at Abington. In fact, my office at Abington was below the sleep clinic. And they did sleep studies and the whole thing there. Those guys are a part of medicine that's totally different. I mean, they think differently. They're looking at different things. They have a lot of technical things they can look at and do testing. So that's an important way to, if you're having problems, it's an important thing to do if you can't come up with the reason for the problem. Hypersomnia, difficulty staying awake in the daytime. Well, maybe that's from the fact that maybe you're not sleeping at night. There could be a whole lot of reasons for that, and we'll probably hit most of them. Circadian rhythm disorders. Most of these circadian rhythm disorders are brought on by not having consistent sleep. So when you start varying, and you work in shifts, you start to develop kind of an off circadian rhythm, and you're going against the grain. And that's where sleep disorders can come in and really be a problem. Parasomnia, unusual behaviors, sleepwalking, that type of thing. Very often I find that's caused by medication. In fact, I think I'm going to stick my neck out there and say I think 85 to 90% of the time adult sleepwalking, it's almost, that person's almost always on Ambien or something else, or sleep eating, that type of thing. Just true sleepwalking, sleep talking, that could just be stress. You see it in little children. You see it all through life. Anybody could sleepwalk. That's usually a stress thing. It's not that common. The common thing is you've been taking Ambien for 3 or 4 years. You're not really sleeping. You're in a kind of a moderate sleep. You never sleep enough. So you can literally get up and walk. Sleep should paralyze you. You shouldn't be able to get up. But when you're in a light sleep, it is possible. It's like hypnosis. You're in an extremely light sleep, which means if we gave you a suggestion to stand up and walk, you should be able to do it. You're not in a true deep sleep. And that's what's going on when you take Ambien and other drugs. You don't go into a full deep sleep. And of course the other problem with Ambien is you've been on it long enough, you'll probably never get off of it. Because it changes your brain waves, and your brain waves may never come back. It is possible. Do it long enough. Anybody, I'm sure, have taken maybe Benadryl and noticed that it made them very sleepy. It's an antihistamine. Antihistamines aren't exactly addictive, but if you take them long enough, it could change your ability, once you stop, could change your ability to go into sleep. Narcolepsy, a sleep disorder that needs professional care. There's just no way around that. If you have narcolepsy, you're in trouble. You need to get professional help. I don't want to talk about that too much because it's, again, rare. And restless leg syndrome. We do point to a couple things that lower your stress level, and when you do that, it seems like the restless leg tends to go away, or it's less so. So we'll discuss a little more about that. But the things that work for that, magnesium, B6, L-theanine, and other stress-reducing supplements seem to do a good job with restless leg. Restless leg also, if there are some people that if they overexert, let's say you've got wheelbarrows of mulch and you do it for 3 hours, your legs are going like this the whole time. And if you're not used to doing a lot of walking, or you don't go to the gym and you don't go on an elliptical, that type of thing, you might find that your muscles keep firing when you're in bed. That's just overexertion. But if you're getting that every night, something else is going on. You're either not warm enough. That's part of restless leg. If you warm up, sometimes the restless leg goes away. If it's too cold, sometimes you just can't relax. It's a matter of relaxing. So magnesium does a great job for that. B6, L-theanine, they're all good that way. Yes?
Do sleep apnea and narcolepsy include traumas?
I hadn't thought about that. Sleep apnea and, yeah, there could be some familial thing, sure. Yeah. To look at the statistics, I don't know for sure. But I do hear it in patients. Before we go any further, I want you to think of something that's not physiologically correct. But think of your brain two halves. One half is the awake half, the other half is the sleep half. So what happens is, when you're in the awake half, you're doing all the things you're supposed to do, right? Work, clean house, whatever it is. Maybe you're working on the computer on some special assignment. I don't know. It could be anything. But all the work that you do, all the brain work you do, physical work you do, creates some chemical trash in your brain. You know, it's that burning the energy, and there's debris left over. That debris keeps dropping into the other half of the brain, the sleep side of the brain. And when you get enough of that debris on the sleep side, guess what? You sleep. And while you sleep, the debris gets cleared out. It's a very healthy process. Now, physiologically, what I'm telling you is nonsense, but it's the only way I can get it across. So, you work that one side of your brain, let the trash go to the other side, and sleep it off. It's that simple. But we disturb that in different ways. Maybe too much trash goes into the one side. Maybe we just don't do enough to get that side working as a sleep side. Just not getting stimulated. And this is all controlled by hormones. These are hormones we're talking about. And a lot of them. I can't even name them all. But there's a few key ones. We're not going to get that deliberate about this. It's kind of deep. But medical conditions like arthritis, back pain, can, for me actually, knee makes it very hard to sleep. Right, so pain's an issue. You've got to correct your... Are we cutting out? No, we're on. Okay. Thought I bumped it. You've got to fix that pain thing, or you're not going to sleep very comfortably. So I know I've had back aches, I've pulled muscles, that type of thing. It's kind of hard laying down and feeling comfortable. Mental health conditions. Well, this is complicated because it could be that your medication, if you're on a medication, could be interfering with your sleep. So you want to talk to whoever prescribed that. You may have to change the time of the medication. Hard to say. But your practitioner should know what that's about. Bladder and prostate problems, it's always a problem. You hear this is I hear it every day here. It happens. Some medications that can disrupt sleep. There's a whole bunch of them. And a lot of this has to do when you take the medication. If you can time out the medication, change the time, sometimes you can beat that. But not always. So it does make sleep difficult. Most sleep medications can change brain waves, preventing deep sleep. So if you had one of those Fitbits that do the sleep monitoring, you'll see that it breaks down to deep sleep and light sleep. And you go through the cycles up, down, it just changes a lot. I did notice, and I've been doing it for a couple of years, if I'm exhausted, if I work like extremely hard, I power wash the whole house, up and down ladders, that kind of thing. It's a pretty good day's work. I noticed that my deep sleep increases. So the amount of work you do, the exhaustion, the tiredness that you have, can give you more deep sleep. And it should give you more deep sleep. That's the way it should work. If I have one of those days where it rains and I'm only sitting at the computer and doing something, I could have a pretty shallow type of sleeping. Changes, you could see the differences. They're significantly different. So hard work is important. We were built, we were cavemen. We're still cavemen. It's only 60,000 years. It takes 100,000 years to change, I think, 2% of your genes. Come close. And of any gene, 100,000 years, it's a long time. I don't think we made it. So we're still those cavemen that spend the day up, hunting and doing really difficult things and a lot of stress and danger and all that kind of thing. You go back to the cave and you sleep, all right, and you recover, and you're ready for the next day. But those guys were exhausted, so they slept. I can't vouch for the women. I don't actually know any cave women, but you could, I'm sure they worked crazy all day. It must have been, very difficult. Today, we sit around an awful lot. And you can see it when you look at the caveman bones till today's bones. Their bones were very big and heavy and very dense. What makes bones dense? Stressing them. Weight on them. The more weight you have on them, what happens when the astronauts go into space? They actually thin their bones in a very short time. That's kind of scary that it could be that fast. So if you have osteoporosis, how did you get there? Look at the astronauts. They can do it in 3 months or 6 months or whatever. It's easier than you think. Now on Earth, we have gravity. You think it would add to our tiredness, which it does, but we don't work enough. We were built to be much more aggressive when it comes to work. Farmers, whatever, hunters. Blood sugars. When blood sugars crash, and they often do at a certain time at night, it could wake you up. Depends on how hard they crash, how deep the curve is. So if you're if you're eating a lot of sugars after 3 or 4 o'clock in the afternoon, that might not be so good. You're much better off eating more protein. And that will stabilize your blood sugars, and it might just, if you're not diabetic, or pre-diabetic, it might just stop that if you're having that issue. I want you to keep the two halves of the brain in mind when you're looking at these things. So the consequences of sleep disorders, they're numerous. There's a lot of them. Sleep disorders can have serious consequences for health and functioning, as many people have found out. How do I go to work when I can't even keep my eyes open? And it just gets complicated. We get grouchy. We don't like people doing things, that annoy us. Adults need 7 to 8 hours of sleep. I remember reading an article by a gentleman who said he only sleeps, I think, 2 hours every night, and he's living a wonderful life. I won't say more about that, but he looked bad, I got to tell you that. They had his picture with his book, and he wrote a book on it, and he looked terrible. And I doubt very much he's still alive, because he was older. And this was 20, 30 years ago. Adults need 7 to 8 hours sleep. That's a sure thing, has to be. And not getting enough can impair memory, focus, mood, physical strength, endurance, the immune system, and very often makes people gain weight. It's just the way it is. Early identification of sleep disorders, very important for treatment. Some things, if you don't catch them early enough, they become, the rest of your life. So it can make things very bad for you. A good sleep person is going to do a detailed history. They might do a sleep evaluation study with the things on your head and all that kind of thing, which we did at Abington. My office would refer people up there, so I used to get to see the chart, the actual sleep charts. And literally, they're looking at parts of your brain waves. So, delta is a sleep brain wave. Delta, if I showed you, I should have put it on here, but if I showed you on my computer a graph of actual brain waves, real time, even though you're awake, some delta waves will shoot out. That's just the way that is. It's nothing wrong with that. But when you get them sleeping, which I don't get to do here, of course, the brain waves flatten out on the high end, and the delta waves start to go up. We should see more delta waves, theta waves, alpha waves, beta waves. We shouldn't see a whole lot while sleeping. Now, we have a dream and it's disturbed. You might see them shoot, and that's fine. But you go back to sleep, and there we go, theta, delta waves. And that's what they look for when they do one of those sleep studies. The other thing the reason we would send people there is we had people awake. We wanted to make sure delta waves weren't causing them cognitive problems. So we would get the sleep study back, and we had a person that we identified as ADHD. Guess what? They had way too many delta waves in the daytime. If you can reverse the delta waves, they'll feel better, and they may perform better. And we used to do that. It's complicated, but it could be done. And in fact, I could do it here, but I don't usually do that kind of thing. These are questions and answers. People always say to me, is a sleep disorder mental illness? Well, yes and no. And some things could be, some things maybe not. But I have to tell you, stress plays a huge, let's see, how can I say this? Your daytime stress is your nighttime sleep disorder, probably in 85% of people. And we hear this all the time, I have no stress. Yeah, but I only sleep 2 hours a night. Well, that alone is stress. So, what are you talking about? You have stress. You're just not identifying it, or you're not admitting, or you're not recognizing it. A good practitioner is going to help you recognize that. Why do we want to sleep, but the body won't let me? Why can't I sleep? Well, a lot of the times we don't know how to relax. And there are a lot of techniques that you can be taught that'll show you how to put yourself into a relaxed state. So if you look at the two halves of the brain again, you have the daytime awake one. That's a hyper side. It has to be, because it's for your own protection. If you become, let's say you're crossing the street, very busy street, you better be hyper. Have you seen people that don't even look? And they march across the street just when the light turns for you to go, and you have to protect them because they have no idea what's going on. That hyper side is the side that keeps your head like this, and you don't get hit by a car. So it's important, to have that going on correctly. If you're too sleepy, you might just not know what you're doing at crossing the street. So, what is sleep anxiety? We often develop sleep anxiety when we fail to sleep. So 3 nights in a row, you haven't slept 2 hours a night. Suddenly you're afraid to go to bed because you think, this is going to be another night of no sleeping, and you just stare at the ceiling. This is a process. You've put yourself into something where you're perpetuating the lack of sleep. It can be habitual. Being able to sleep is a good habit. Not being able to sleep is a bad habit. You've done something wrong. So let me just keep going. That's our time. Good. I can fall asleep, but I can't stay asleep. Well, this is really common. So what happens is, for many people, they never quite get into deep enough sleep. So when hormones change, maybe blood sugar changes a little bit, it's enough to wake them up. And they very often wake up with a hyperarousal. All right, and that's habitual too. Like, I'm up, Did I hear something? Somebody breaking in? Did the dog bark? What's going on? Do I smell smoke? So, hyperaroused, not going back to sleep quickly. Somebody who wakes up, rolls over and goes back to sleep, they're doing fine. It's all right to wake up. You just got to get back to sleep. Daytime stress may be your... Oh, I said it here. That's good. Daytime stress may be your nighttime sleep problem. That is something that should stick in your mind. Start looking for what's causing you... You're a little sleepy, I can see that. That could be what your problem is. You're looking for that stressor. It could be the boss. It could be, people you work with. It just could be the work itself. You're tired of it. It isn't fulfilling you. All right, making your brain really work. If you do it and you finish, did you really get into it deep enough to really make it meaningful? Work should be meaningful. I know in this culture today, we do things, we get paid, we go home. How meaningful is that? It's nice when you have a job, you can say, look, I did this today, can we all do that? Not so easy. Over time, sleep deprivation can lead to obesity, diabetes, high blood pressure, heart disease, stroke, cognitive dysfunctions, and poor mental health. When I joined the practice at Abington, one of the other therapists there, and I was just a part-time new guy, and they took me into one of the treatment rooms. They had a little library there, and she pulled this book off the shelf, and she showed it to me, and she said, you got to read this book. And I had read the title. It says 129 conditions caused by stress. Right away I thought, wait a minute, 129? I never counted them, but that sounds like a lot. I went through the list and I'm there, it's 129. Stress is really important. I tell people that if you really think about it, what's our number one health problem in the United States? You're going to go cancer, heart disease. It's mental health. Mental health is the biggest problem. Now, we don't recognize a lot of the small conditions as serious mental health, obviously not. But, people have phobias, the sleep issue, stress. Phobias are, once you start hearing phobias, you go, wait a minute, that isn't even possible. But it is possible. And I'll give you an example. Had a client who couldn't cross bridges, he said to me, in his car. And I thought, all right, all bridges? I said the right thing, fortunately. And he said, oh, no, not all bridges. I go, where do you live? And I forget where it was, but it's a little tiny bridge. I knew where he lived. I said, you can cross that bridge? And he goes, oh, yeah, that's not a problem. So I said, well, what happens? And he goes, he worked in New Jersey. And we finally got to the point that it's on the way to work. When he crosses one of the big bridges, he can't do it. He goes into a full panic attack. So now I've narrowed this down. He doesn't like his job. It's that simple. But that's not what he told me. He told me he can't cross bridges, which would be a pretty interesting phobia, right? You cross that New Hope Bridge. How hard is that one? I don't know if you guys know New Hope, Bucks County, so I don't know your bridges over here. But that's a narrow bridge. I love going back and forth. It's fun. Some people probably think, oh, God, this is really narrow, That's not narrow. 2 miles down is the Washington Crossing Bridge. That one is narrow. Yeah. If you've got big mirrors on the side, good luck if a truck's coming over that thing. So that would give me anxiety. I do use it, though. It's very convenient. So that's the kind of thing you look for. What's the root of the problem? Not, it's not a phobia, I can't cross bridges. You can cross bridges, you just can't go to work and feel comfortable. So, and that's just one way of framing it. It could have been he's actually phobic on bridges, but that's not what this guy was. So, what do we got here? Your sleep problems are almost always a symptom of your stress issues. And I think you're going to find that all sleep issues, all 85% of sleep issues are caused by some stress factor. You just got to figure out what it is. And it's not easy sometimes. If you're retired, you do nothing all day, or you relax all day, you take walks, and where's the stress? So just to throw that back at you, my father owned a diner in South Philadelphia, and next door was railroad workers, there were dock workers, there were meat factory and meat processing plants. So a lot of them that worked early in the morning, like the railroad workers and the dock workers and actually hackers, they would retire. Guess who came to breakfast within a week? Just like a normal day at 5 in the morning. The guy that retired. They can't sleep. They're hooked on that shift, on that timing. What are they doing? What are they going to sit at home till everybody wakes up? They get in their cars, they get on the whatever it is down there, transportation, and they come and have breakfast with their buddies at the diner. Well, they're not, they can't break that habit. So, it's not a bad habit, especially if you go to bed at, they're going to bed 9:30, 10 o'clock, waking up at 5. My own father would go to bed at 10:30, and he'd be at the diner at 5:30 in the morning. And he did that for at least 20 years, maybe more. And he couldn't break that habit. It took him a good 5 or 6 years to break that habit. And he still woke up early. It's just not an easy thing to do. So, it's a habitual thing your brain learns. But that particular one isn't that unhealthy. He wakes up with the sun, goes to sleep when it starts. Pretty healthy way to live. Let's see. So this is very, very important. And I'm going to put on my glasses so I can read this, because I had no way of enlarging this. It's in a format. One of these days I'll redo it, but it's hard work. So, stress damage, I called it. I don't think that was the official title. But what is it about stress that causes damage, that causes our problems? So if you look at the top left, increased cholesterol, fatty acids in the blood, which is elevated triglycerides, decreased protein synthesis. This is all part of that lack of sleep, that increased stress, the change in the hormones, increased inflammation, which irritates the inside of your arteries, the endothelium, causing plaque or calcium to stick to the walls of arteries, leading to heart disease. That's how sleep causes heart disease. It's simpler than it looks. It's logical. Increased blood pressure. You can imagine stress increases your blood pressure. Increased metabolism, faster heart rate, faster respiration. All those things are not good for sleeping. And what I do here is I teach breathing techniques to get you to sleep better. It works. It's a good system. And you learn how to do it in a couple sessions. You go home, we put something on your iPhone or your Android phone, and you practice. And you learn how to get yourself into the sleep mode. It's not rocket science. It's pretty easy to do. Most people can do it. Every once in a while, somebody's too stressed to do it. But mostly they can get to learn how to do it. Here we go with localized inflammation, swelling, faster blood clotting. That's not a good thing because that's a stroke thing. All right. People under extreme stress, actually, I think I've seen several studies that show that they become more likely to have a stroke, especially if they already have something going on in the arteries. So you don't want to have that. And increased production of blood sugar. There's your diabetes. Increased stomach acid. There's your reflux disease. There's your ulcerations. So you can go right around those conditions and actually say, hey, this is stroke, this is heart disease, and that 129 conditions caused by stress, you get up to 80s pretty quickly. After that, you got to scratch a little bit, think about it, but it doesn't take long to make the 129. And yes, go ahead.
Blood clotting.
Yes.
How would you know whether your system is doing that? If you, for instance, have blood taken and they put the Band-Aid on you, and you never even have a little bit of blood. Nothing.
That doesn't mean it's a problem.
Okay,
you can't see this.
Okay.
Can they measure it? Maybe sophisticated blood tests might. That would be your prothrombin time, or maybe they're measuring K, or something like that. Maybe they could identify that, or maybe this sneaks up on you and bang, you have a stroke. You never figure it out. So it's not that easy. Let's go to, okay. Stress reduction, I talked about breathing. I actually do that here. I do it with biofeedback, which was my specialty at Abingdon Hospital. We did this over and over again. I did it probably 8 times a day, an hour with each patient. It was a pleasant kind of a situation because you relax the person, and you needed to be relaxed yourself or it wouldn't work. That's very important. The practitioner can't put their own stress on the patient. You have to go to that place too. It's not that hard to do. So you can do it with the patient, and they can feel that. And I'll give you an example. When you go for a massage, I'm assuming somebody here has had massages. The massage person might say, "Oh, relax, breathe." And once you get into that breathing mode, that relaxation, and that massage person is usually in that same place, you can feel it. You can feel the change. So it's a real important thing. Hypnosis, I do that. Don't do a lot of it, but hypnosis can help. Actually, biofeedback, in its true sense, if you let yourself really learn from the biofeedback, you're actually having a trance situation. When you're breathing, you're inducing a trance. When you're breathing efficiently and in a relaxed way, that induces a trance. It's a light trance, but it's what puts you into the mode of relaxation. And then there's all kinds of sleep therapies that you could go through. They can get expensive and they're time-consuming. So you always start with the simple, easiest thing. And if you can make that work for you, great. Now let's talk about the supplements. Supplements can help for a lot of sleep issues, especially if you catch things early. Magnesium. Magnesium is a mineral. It's very, very relaxing to muscles and neurologically. Just so you know, we now have magnesiums that cross the blood-brain barrier that are more efficient than the other magnesiums. That's important. So we have an acetylated magnesium from Enzymatica, which enters the brain pretty effectively, helps you sleep. An older line is an older product is magnesium L-threonate, which does that also. But I think we're finding that that's good for memory and cognitive function. This one seems to be a little better for sleep. Yes?
What time of day are you taking magnesium?
Well, they'll tell you to take like 1 in the morning and 1 at bedtime. Maybe even 3. I forget what their full dose is. This is a 3 a day. All right, the other one that crosses the blood-brain barrier. If you use glycinate, magnesium glycinate, it could also help you. Doesn't mean it doesn't work. You just don't get as much into the brain. Not everybody needs the full jolt, right? Maybe a little magnesium works for you. The thing with magnesium glycinate, it's pretty good at relaxing muscles also. So if you've got more of a muscular issue when you go to bed, if you do have restless leg, maybe glycinate's a better choice in the magnesiums, or malate. I don't have a malate here, but that would work. Let me make sure I do this logically and in a row. All right, so magnesium, we talked about the one that crosses the blood-brain barrier, the 2 of them. Taurine. Taurine is a precursor for GABA. GABA, anybody heard of GABA here? How many people know what GABA is? You've heard of it. So GABA is a neurotransmitter in your brain that helps you relax, feel calm, takes away stress, and it might even help you sleep. Taurine is the precursor for GABA, makes you form GABA, and it could help you sleep. So you could take 500 milligrams or 1,000 milligrams of taurine after dinner or near bedtime. It might help you sleep because it stimulates GABA. So GABA is a product and a neurotransmitter. So GABA aminobutyric acid is an amino acid combination. It's not a basic amino like lysine or taurine, but it can be very effective. So taurine, you don't necessarily need GABA. Taurine can do that for you. Glycine, let's see if we have that listed. I may not. But glycine is another precursor for GABA. Might even be better than taurine for sleep. You have to try and see which one works for you. But I think what we found, and maybe I have this listed. I don't. Oh, yes, I do. They're talking about 3 grams of, when they talk about 3 grams of glycine, they're talking about a couple of grams during the day and 1 at bedtime. Or 1 gram during the day, 2 at bedtime. I don't think you're going to take 3 at bedtime. And glycine, of course, bedtime's a good time to take it because you don't want to take amino acids. These are all amino acids on an empty stomach. I mean, you do want it on an empty stomach. You don't want it with food. It'll work better. GABA can be used with glycine and taurine. It sounds like overkill to me. I think you might do glycine and GABA. Yes?
The GABA, the type that you can buy, does not necessarily cross the blood-brain barrier.
So I'm glad you brought that up. There's 2 types of GABA. There's the old-fashioned GABA that we've been stuck with for in the 90s and the early 2000s. Somebody brought out a GABA that crosses the blood-brain barrier, and it's called pharma-GABA. That's the one you want to use. And we here at Holly Hill have an exclusive product. It's a chewable GABA. What it is, it's a fermented GABA. And by the way, it's a trademarked, I don't think it's patented, but it's a trademarked product, so nobody else has it. Not only does 200 milligrams, which is average dose, work longer, but you can make it a 1 a day. So this, instead of taking it in the morning, let's say you have attention issues or memory issues. You could take this in the morning, obviously. But for sleep issues, you might take this after dinner or closer to bedtime. So you kind of flip the page here. You kind of flip the script on this. You made it a sleep product rather than a product for concentration and focus. So that's very unique. It is a trademark, so other companies won't have use of it, I don't know how many years. It's at least 5 years before it can be used by anybody else. Yes?
Maybe this is the place to talk about another thing. Glutamate and GABA work, I guess, in a way they try to stabilize each other, correct? Glutamate is exciting.
Yes.
Okay. And I'm looking at that.
Mm-hmm.
And GABA is the inhibitory version.
Yes.
Presumably, that's keeping track of the balance.
Mm-hmm.
It's a challenge.
90% of your brain is focused and works all the time in inhibition. 10% of us is the excitatory. Without that 90% inhibition, we'd be shooting each other, we'd be robbing banks, we'd be drinking, we'd be having, it would be a nightmare. Humans cannot live without inhibition. Got to have inhibition. So if we can take this to, let's say, you look at a first grade class, and there's 1 or 2 kids bouncing in the seat. Well, they have a little less inhibition than they need. Maturity could be a lot of things. Could be a sign of something else, but could be just maturity. So we need inhibition. Did you have a question?
Yeah, is there a product that has all 3 of those together?
No. And for good reason. You really shouldn't. That would not be logical to have something like that. Too many things. You really want to experiment with one thing at a time and see what works and what doesn't. Why take more than you need to? Also would make it kind of expensive. You got to figure pharma-GABA is a patent. Somebody has to pay the patent rights to put it on the shelf, bottle it, put it on the shelf. Our GABA, we have to pay the extra money for that fermented version of GABA. It's just like a prescription product. When it comes out, we're paying for that patent right. It might only be 10 years or 15 years, depending how quick they get it to market. But you got to pay for it when it comes out. So old-fashioned GABA, you can get 750 milligrams of old-fashioned GABA for less than $10. But what good is it? You got to take 4 or 5 a day. It's very high. It could give you like a tingling if you take too much. Pharma-GABA, 200 milligrams usually does the job once or twice a day. So there's no reason to combine too many of these things. Dr. Mercola has one, I don't think I have up here, that's GABA with L-theanine. By the way, excuse me, I forgot to mention L-theanine has a patented version, which everybody uses, or a trademark version, called sun-theanine. That also crosses the blood-brain barrier. So Dr. Mercola brought out a GABA L-theanine product. The L-theanine is sun-theanine. Everybody uses sun-theanine. But he used old-fashioned GABA. Now, it's not wrong, because the L-theanine is doing a lot of the work. It's the workhorse. So he adds a little GABA. He didn't necessarily have to use pharma GABA, and that might just create a little more relaxation. So it's not a bad product. It's the closest thing to what you're asking for, and it might work. It might be fine, but it's not pharma GABA. It's not pharma GABA he's using. That's the only product I know of. Let's just keep going through these because now we are pushing time.
Dr. Bill?
Yes.
I have a quick question.
Yes.
Okay, so you're right. So you're talking about the supplements, but I just thought about a podcast doctor who suggests ordination of this podcast that there's some foods that can also put you to sleep, like kiwi, kiwi. And I thought, oh, that's good. I don't know what that has in it.
Yep.
But yeah, you mentioned that.
Here you go. Milk and turkey.
Huh?
Milk and turkey. Proteins in general can make you sleepy. So that's part of it. Tryptophan is a wonderful amino acid, and I know a lot of my doctor friends that use it for daytime anxiety. I couldn't, if I was a patient, I couldn't do it, because if I have the slightest bit of tryptophan, I'm out cold. That would worry me if I was the practitioner. Am I going to send this person home and they crash the car? But they take their time, start very low dosing, spread it out through the day, hit them with a higher dose at bedtime. They know how to do it. They're taking the risk. They've got the big insurance. They can do it. When I give tryptophan, I just say take 2 grams when you go to bed, or take 1 gram when you go to bed, and expect to sleep deep and long. Yes?
I take magnesium, but I still don't sleep. So would taking tryptophan be better?
Might be an add-on, yes.
Okay.
And I like that because magnesium is a mineral. This is an amino acid. So we're not choosing 2 things from the same category. Oh, and also tryptophan does stimulate serotonin very effectively. That's why doctors do use it for anxiety and depression. It's a possibility that it could work quite well. More so than prescription serotonin reuptake inhibitors, which have a lot of flaws. One thing that we were a psychiatric practice, and one thing we hated was all the callbacks. I can't wake up, I can't go to sleep, I'm throwing up, whatever it is that they're having problems with, you get those callbacks and you've got to deal with them. No doctor, well, they'll deal with them, but they really find that a problem because now they can't do their hours. So you don't want callbacks, if possible. It's going to happen in psychiatry, obviously. But you try to limit them. In our practice, we did very well by having microdosing. So everything we did with a tablet. If you have a capsule, we rarely use capsule type products because we wanted to start everybody at the lowest dose at a 1/4 tablet. So these are real small doses, and we would build up over a month, and we had less callbacks. Supplements probably don't have to do that. You just got to find the right dose, but you're not going to have significant side effects to deal with. You're either going to sleep or you're not. So maybe you didn't hit the right dose. Maybe you got to increase the dose. In some cases, like melatonin, which we will talk about, too much melatonin can keep you up. So it can be stimulating. So these doses over 5 to 10, I see one 20 milligrams of melatonin. I don't know who's using those. It seems to me you could overstimulate with those. Some people it probably works, but I think it overstimulates a lot of folks. L-theanine. Again, it's not just L-theanine, it's sun-theanine, but everybody uses sun-theanine. It doesn't matter what the product is, it's always sun-theanine. I've never seen regular L-theanine by itself. I just don't see that. So L-theanine, wonderful daytime de-stressor. Works for restless leg. It can be used as a sleep product. Take a little extra at bedtime, or just take the 200 at bedtime, see what happens. I have had people as high as 200 milligrams 3 times a day. So we're dealing with their daytime morning stress, afternoon stress, and bedtime because they can't sleep. And they've done quite well. You go to where am I trying to go with the math? 800 milligrams of theanine a day could make somebody so tired they can't hold their head up during the day. I mean, that's a real possibility, and it's too high. 600 may be the max. And you've got to experiment. You've got to figure that out.
Magnesium with tea.
You mean the other product I was talking about?
If you're using it
Or using them by themselves? Yeah.
in conjunction.
Could be used together.
And is it magnesium fully? Is it like a combination of magnesium or magnesium glycinate? Is there
Well,
so many different variations of magnesium?
right.
Very confusing.
What we've talked about here is magnesium glycinate. It does not cross the blood-brain barrier very well. Magnesium ATP, which is an acetylated magnesium, crosses the blood-brain barrier very well and has even less side effects than your average magnesium as a result of that. And then we have magnesium L-threonate, an amino acid type of magnesium attachment to the base. Everything needs a base to use it. You could say it's chelated to magnesium L-threonate or whatever. Magnesium L-threonate, magnesium glycinate. So it's got to be attached to something. And they're usually chelated to. And chelating means it's just hooked to it. It can get a lot more complicated, but just think of it that way. It's hooked to some base. And there's magnesium malate, which I don't have up here. If you had a lot of muscle issues, that would be more of a magnesium malate. Leg cramps, that type of thing. I wouldn't use it for sleep, although a lot of people say, wow, I sleep better. Well, they might sleep better because they're not having leg spasms, or maybe they're not having a restless leg. So there's logic to that. Any other questions on GABA or L-theanine?
Well, question on magnesium. Is it okay to combine like magnesium malate with the magnesium like ATP to get the muscle help with your cramps?
Okay, so this is where you run into a little problem. Not everyone, but the overdose of magnesium is diarrhea or loose bowels. You can't push magnesium very far. That's why sometimes rather than push the magnesium, you add something else like magnesium and L-theanine. So if you got restless leg and the magnesium doesn't quite take care of it, just don't push the magnesium, add the L-theanine, see if that makes a difference. But if you push magnesium in the wrong person, problems. Yes?
Can you take this during the day and I forget what the one before it? Could you combine them, like the one?
Magnesium.
Yeah, that one. The one before. Can you take that at night?
Sure.
So you could take this during the day and then switch to that at night.
Yeah, as long as you don't push the dose.
Got it.
Oh, well, we'll get to that. I think we're hearing. Is everybody hearing the questions? I'll repeat them if that's the case. We have a mic, but it's going to get difficult. Any other questions at this point? All right, let's see where we're at. 5-HTP. So maybe tryptophan's too much for you. This is a precursor to tryptophan. And you can take it in the daytime, and it really doesn't make you sleepy unless you took 3 grams or something. But the standard dose, 100 milligrams, 200 milligrams, it's not going to make you sleepy. It's going to take away some of that daytime stress. And then maybe you'll take a melatonin at bedtime, I don't know. And it just might fix everything. Or just 5-HTP 3 times a day. It might just fix the issue. If a serotonin reuptake inhibitor can fix your sleep problem, which people say does, why not 5-HTP? They're doing the same thing generally. Pharmacologically, it's a bit different, but you're either holding back your serotonin or you're actually making your own serotonin. It doesn't matter. You've got serotonin to work with, and suddenly you're sleeping better. So when you've got lots of serotonin in the daytime, you tend to produce maybe more melatonin at night, your own natural melatonin. They're like this, melatonin and serotonin in your body. You need melatonin to sleep, serotonin to stay awake. Or at least with the daytime. The sunlight creates that serotonin activity. Think back to the 2 halves of the brain. The active side of the brain, the sleep side of the brain. All right? Serotonin, melatonin. It all fits into that sleep-awake formula. Really, it's very basic. That's exactly what it is. You need that sleep. You need that awake time. A very, very important balance. 5-HTP isn't found in foods. That's an important issue. That's just a precursor they pull out. It's a combination amino acid that they make. Somebody thought it up somewhere along the way. I don't know how they do it.
Is the appetite thing that you mentioned there, is that to help you with your appetite or to decrease your appetite?
You could lose weight with 5-HTP. If you increase serotonin with a serotonin reuptake inhibitor, some people eat more. So it's not quite the same thing. But when you balance serotonin and melatonin out correctly, you actually could start to lose weight. I don't think it's more than 10 pounds, but it could be done. And vice versa, if your serotonin isn't working properly, you just might gain a lot of weight. In fact, you do. And if you don't sleep well, you gain weight. I think the eating has to do with de-stressing. Question?
Yeah, so there are different types of 5-HTP. Like, if you recommend a certain brand, or
They're all the same. Yeah, I don't know of any variations. And you will find 5-HTP mixed in other combination sleep products. I don't want to get into that because then it gets really complicated. Now we all know about CBD, don't we? Basically, there's no THC. THC, I don't think it's that great a sleep component, so it's not necessary. And you can relax with CBD with the less than 1%. They tell you THC. You can only get it down so far. So they say if it's less than 1%, it's CBD. If you go out to our counter, you'll see some high THC products, and they clearly mark it. So they're different. Anybody, well, I won't say anybody having experience with CBD, but it's calming, it's relaxing. It can be a pain reliever. It's a category for sleep that's pretty good. You know, its anti-inflammatory part is important if you're having a lot of muscle aches, joint pain, that type of thing. It takes you down a peg so you can slip into sleep a little easier. Is it going to be perfect every night? Nothing's perfect every night. Because you're not doing something during the day the same every day. Riboflavin. This is kind of an oddball, but I threw it in there. I have been a riboflavin person since '99, I guess, when I read the migraine studies done at the Cleveland Clinic. And they're very dramatic. I mean, at the time I was working, or maybe just before that, a couple of years before that, I worked on Emitrex studies of Emitrex. I worked for Glaxo. That was the first true anti-migraine product, a tryptin product, the first. And it could fix a migraine very quickly. But at the same time, I started reading about B2. I'm thinking, we just spent $60 million doing studies on Emitrex and riboflavin sitting on the shelf in every health food store. How is that possible? Since then, back then when they did the studies, they only had 100 milligrams of B2 in a tablet, and that's all anybody ever made, capsule tablet. Since then, I guess somewhere after 2010, somebody brought out a 400 milligram capsule of riboflavin, which is what the dosage is in the Cleveland Clinic studies. That will fix your migraine over time. So what happens is people start taking it after the first bottle. They go, my migraines never went away, I'm not taking it anymore. Well, you didn't go long enough. It's on you. You've got to know how to do it. Now, I've had people go 9 months before the migraines went away, really lessened. But it works. And it works for most migraines. But it has a lot of other things going on in it that can be helpful for sleep. Regulates your metabolism, balances your blood sugars. I forget what I have here. Well, it is an antioxidant. I don't think that's terribly important for this. Cell growth and function. It might be anti-inflammatory in that sense. Vision. Cataracts, I don't know if that's true or not, but I'll tell you what I've discovered. If you're having visual migraines, anybody familiar with these? They can be quite debilitating. You can actually be blind. You'll see light, but you can't see what you're looking at. Takes it away real quick. I'm talking the first bottle. I've had really great luck with it. So I start thinking, what else? So then I had somebody with not quite correctly diagnosed balance problems. And suddenly I started thinking, wait a minute, if we can have optical migraine, why can't we have vestibular migraine? Turns out somebody's studying that. I went, checked my Google machine, and guess what? People were looking at that, but not necessarily riboflavin. Gave the person riboflavin, and guess what? In a very short time, their dizziness went away. Now, that's migraine dizziness. It's not every dizziness. So I put it in here because it's calming, it's relaxing, and it does seem to help with those things that can mess up sleep. Yes?
Is it good for diabetics and people with high cholesterol?
It is. There's other things that are better, but it's certainly not going to hurt, and it probably would help. That's good. I'm saving that for the diabetic talk. Yes? No. 400 milligrams, that's a lot. 400 milligrams a day, nobody even ever thought of that. But the Cleveland Clinic did. And I'm not sure what caused them to think of that. That would be an interesting thing to learn, but probably most of the people that did those studies have retired now. Who knows? We'll ever know. How did they come up with that? All right, so...
riboflavin does a lot of...
Am I still on, guys? You still hear me?
Riboflavin does a lot of wonderful
things.
But it says not with women.
Well, the studies say that it's not as effective with women. But maybe the study's not right. So why wouldn't you try it? A bottle of... it's very inexpensive. That's a bottle of 30, I believe. It's worth a try. Now, if it works, if you notice some success, we sell another product where you can get it in 90s or 100, and it even becomes less money. But that product we have a hard time keeping in. It is here now, I believe. It's biotech. But it doesn't matter. There isn't much difference. These are all very inexpensive. And they could be helpful along with an L-theanine or magnesium or one of these other products to help you sleep. And that's what we're talking about today. How are we going to help you sleep if we go the supplement route? Inositol, the last one. So inositol is a B vitamin that isn't often in a B complex. Sometimes it is, sometimes it isn't. But inositol makes all those neurotransmitters that help you sleep better work better. So it's a good add-on to anything else you do. Really effective. Inositol is very inexpensive product, underrated product. I don't know if I put the other uses of inositol in here, but to me, if we're talking, actually, you could actually infer. These neurotransmitters are involved in sleep. It could have to do with weight. It could be a lot of things. All those things that you worry about when you're having sleep issues, inositol could be a real basic product for that, a real important product. So I think I've covered supplements. So I think we're going to go to best advice and fresh air and sunlight. So again, think about your brain, the two halves. Is dark going to fix the hyper side? No. Sunlight. Stimulation. So let's say you live in a cold climate. You can't get outside. And you are having sleep problems, which very often happen in colder climates. That's not unusual. You open those curtains and you sit in front of the window, whether it's cloudy or sunny, and you just sit in front of that window and get yourself some sunlight, and it will help your sleep. Didn't cost you a thing. Well, you had to buy the house or rent the apartment. But it's a freebie for most people, and it's an important one. Don't underestimate sunlight and sleep. Fresh air. The more fresh air you breathe, the better you're going to sleep. You know, have you ever been in a situation where you're out, your car breaks down, you have to hike 5 miles, you're going to sleep pretty good that night. Yeah. So, very important stuff. Hard physical labor. We're built to do hard physical labor. We were never built to sit behind a desk and work on a computer or write. It just didn't exist when the caveman was invented, or however it happened. So hard work is very important for everybody. Just standing on your feet is important. What are we doing today? People have stand-up desks. They have treadmills under the desk. That's one step too far for me. But, no pun intended with a step. I know how that happened. But you got to work. You got to do things. You got to do weight-bearing things, and you will sleep better. You know, people come in to me and they say, you know, I'm retired. I mean, what do you do all day? I watch TV, go shopping maybe. What are they doing? They're not really doing anything stressful or in the form of exercise or anything. And it's not their lifestyle before they retired. They did a lot more before they retired. Suddenly they can't sleep. But they don't know why they can't sleep. Well, the answer is pretty simple on that one, right? No late night devices. This is becoming really a problem. Light is daytime stuff. Light is not nighttime. So we've got to put that in perspective. Also, when you're on a device, more than likely you're reading something that is hyper causing, just distressing. Maybe the movie you're watching is distressing. Actually, I do see a difference if I watch a comedy versus a drama. All right, I feel much more relaxed after the comedy. I mean, that only makes sense. Best thing to do is not be watching TV up till you try to go to sleep, especially if you're having a sleep problem. I always found Johnny Carson put me to sleep. As soon as he left, for some reason I couldn't sleep. Who was the next guy? Jay Leno? Was it Jay Leno the next guy? He was not a guy who gave me sleep, so I didn't watch it. But Johnny Carson is like, bang. You know, I don't think I could ever do more than 5 minutes. The man bored me to sleep. And yet he was successful. Well, maybe that's why he was successful. Avoid excitement after dinner. You know, I find that if I prefer working out during the day, working out at night can be a little too much activity. Hobbies even. I have a couple hobbies, and if I do them too close to bedtime, it doesn't work for me. It raises that right side of the brain, the activity. And this is super important. Eating light and early. Well, first of all, fasting is important. So when you eat dinner and you go to sleep and you don't wake up till the next morning, you fasted. And that's good for your blood sugar and for repair of things and for your liver and everything. The longer you fast, the better it is for you. So if you eat dinner at 8 o'clock and you wake up at 5 and have breakfast, you're not doing so well. If you eat your last meal at 5 o'clock and you wake up at 6 or 7, you're doing a lot better. It just works much better. You fasted, you've made your blood sugars more regulated, you've lowered glucose, everything about it is right. And you'll probably lose weight. It's just the way it goes. You're starting to burn some fat. Yes?
I do all of that. I eat at 4 o'clock, nothing after.
Mm-hmm.
I cannot sleep past 3 o'clock in the morning. Circadian rhythm is what I'm attached to all my life. 6 hours at most of sleep at night. Never had any more.
You've had that all your life?
All my life.
Okay, so now what you're listening to is a habituated sleep pattern. We all have it, or most of us have a habituated sleep pattern, or it starts changing on us when we get older, or something happens in our lives. But there's a lifelong habituated sleep pattern, and maybe just fine. Are you tired all day?
I'm never tired.
There you go. So what's wrong with that?
Well, I had numerous sleep studies. I wake up about 57, 58 times every night without knowing it. But I'm awake on all the testing. I'm awake.
Yes. That's a very individualized thing. In your case, I'm not sure there's anything bad about it.
I went through World War II.
You didn't cause it.
No,
All right.
I went through it.
I didn't quite hear that.
All the lovely stuff, you know.
Okay.
Through bombs.
So you
every night and all of that.
Right. So you went through some very difficult times, which would wreck your sleep, I'm sure.
PTSD, you know, all
Yeah.
that lovely stuff. But I cannot get my sleep regulated.
And you may never, unfortunately, because you've got the pattern so built in, it's very hard to get out. You might consider very subtle things, and I left melatonin to last, but you might consider very tiny doses of melatonin. I thought I had my boxes of melatonin.
I take 5 milligrams before I go to sleep.
Probably too much.
No trouble falling asleep.
Yes.
The first time.
Yes.
But if I wake up at 11, 12 o'clock,
Yes.
the second dose of the 5 milligrams will no longer work.
So you try to take a second dose. Yeah.
Done.
Generally speaking, if I was going to counsel you on this, I'd say you can go to sleep, right? Why are you taking the melatonin then to go to sleep?
I not only take the melatonin, I have a glass of very warm milk.
Yeah.
I do the whole.
I would suggest for a pattern like that, or anybody who wakes up at 3 o'clock or whatever, don't take anything until you wake up. Then take a tiny dose of melatonin, something like a sublingual that's going to melt in your mouth, or drops. We have both. I wish I brought those up here, but they're in the sleep section. And just roll over and go back to sleep. It'll kick in pretty quickly.
I've tried that too.
But it's a perfect example of what people go through. They wake up, and sometimes they wake up very refreshed. I've done it. I'm like, wow, ready to go. It's usually something like this where I wake up too early. For some reason last night I just slept when I woke up I quickly looked at the clock. I thought I was late. I was actually late. So why did I sleep so well? I don't know. Should not have, but I did. So waking up like that may not work for you, but for most people, take a little melatonin, not a lot, and give that a try. See if it works for you. You might actually learn how to break that cycle. You can train that cycle out. Maybe you can't, but most people could. Yes.
Eat light and early. When you say eat light,
Yes.
dinner And early, what is the earliest time thing, or the latest time to eat?
There's no too early for dinner. The earlier the better. If you eat more at lunch, you'll tend to eat less for dinner. You know, we eat pyramidally. Small breakfast, larger lunch, big dinner. Exactly what you don't need. In fact, if you flip the pyramid, you'd be in better shape.
That's how Europeans eat.
Yes.
We have dinner for breakfast,
Right.
and we have breakfast for lunch,
Yes.
and we have maybe a piece of fish or
Yes.
a light salad at 4 o'clock, something like that, and we're done.
Yes. It's exactly how they eat.
They had a saying to eat breakfast like a king, lunch
Mhm.
for a prince, and dinner as a pauper.
Yeah. Yes. We eat wrong. We really do. Sleep when it's dark. Awake when it's light. We talked about that. Have a sleep routine. You know, we hear sleep hygiene, keep the room dark, go to sleep at the same time every night, wake up roughly at the same time every day. If you remember Dr. Jim Corey, who I was friends with, used to be on his radio show occasionally, WWDB radio, I guess it was. He was a pretty famous guy, but he would say that every time somebody came on the phone with people would call in, they had some sleep disturbance. He said, well, get that part right. Go to sleep at the same time, wake up at the same time. And he did exactly that every day.
My
We
lights
can-
go off at 8:30.
Hmm?
Whoever is there at 8:30 just walks out the door. They know.
Yeah. Okay. So sleep routine, extremely important. Okay, now that we're going to get a little heavy, last slide. Nobody gets well until they want to get well. Doesn't matter what the condition is. You got to want to get well. And people will come to their practitioners. I hear it from my doctor friends all the time. Person comes in, tells me what they're having, refuses to do what I tell them to do. Because they don't want to get well. They haven't gotten to the point where they go, I really want to get well. There is a point. You think about in your mind that you want to get well. It's important. Nobody has tried everything. The reason I say that is people always say, I tried everything, I can't get better. You never tried everything. Nobody ever tries everything. You just haven't thought it out. You haven't gotten a good diagnosis. You don't have the right practitioner. And you haven't done the work that it would take to fix it. Just haven't done it right quite yet. And there are some conditions. You go from one doctor to another. Each one tells you you have his specialty. Oh, you have endocrine something or other. You have a thyroid problem. You go to the orthopod. He says, oh, you can't sleep because your back hurts. Well, what now? All right, that's a long one. But they're going to do it. You go to a specialist. If he even sees an inkling of his specialty, you're in. You're not getting away. All right, until he's gone through everything. Maybe stop short of surgery if you're lucky. So that's what you got to do. Sometimes you got to be your own. Most of the time, you got to be your own advocate, or find somebody who can be your advocate. So probably when you have a condition and you don't know much about it, it's good to bring somebody with you who knows what they're talking about or has a good idea. Be open to accepting guidance from your practitioner. All right, you got to listen to what they say, and you got to try to do it. Sometimes it's easier said than done. If you've been disappointed by one practitioner after another, you probably haven't either not found the right practitioner, or you just don't quite have the condition diagnosed correctly. So don't panic. Well, you could panic, I guess, but you're just not there yet. So you've got to keep searching. More questions? And I think we hit the end. I should have put the end on there.
Could you tell us about the zinc chelate?
It's just a good zinc.
For what?
And zinc's for your immune system. And we're offering some zinc. We sell a lot of zinc. Zinc is a very good thing for your immune system. By the way, if you don't have a good immune system, you may not be able to sleep that well.
My immune system is perfect. I got over a really nasty case of COVID with 102.7 temperature in 48 hours.
Mm-hmm. Yep, that's why I don't know that you will really have a sleep problem. You may be doing what you're supposed to be doing. You know, there's some nights I get 6 hours sleep, and there's some nights I get 8 hours sleep. And sometimes on the 6 hour sleep night, I feel great.
I've never had that.
But on the 8 hour sleep, sometimes I'm pretty groggy. Takes me a
I
while.
even asked not to remember my dreams. I have not remembered my dreams since I was 30. But I couldn't take it anymore.
Well, you say you can't remember the dreams,
No.
but you know you're having them.
Oh yes, I know. And
Okay.
once in a while I can, but I can't
Pick out a piece of
cannot
information.
get a
yeah.
hold of it.
Dreams are a very complicated thing, and there are a lot of new dream specialists out there. I don't know what to think of it, but I'm the only reason I ever wake up at night on a regular basis. I dream. I dream a lot. Sometimes I dream 5 times, and it arouses me. Probably hits me, and I'm probably dreaming way more than that. I'm sure I am, but it probably hits me during the light sleep cycle when I'm transitioning. I have a dream, and it's just enough to go, oh, I'm up, And usually I just roll over and go back to sleep, so that's pretty healthy. If it keeps you up for 2 hours, that's kind of annoying. Yes?
So does dream mean that you're having a deep sleep or light sleep?
Let's do this, so I don't have to repeat this. Pass this around for questions, if you would.
Does dream mean that you're having a light sleep or a deep sleep?
You're always dreaming. It just depends how deep in the sleep you are. Are you in a light phase of your sleep and it wakes you up? But everybody dreams. It's a necessity. If you don't dream, you're either on so many drugs that you can't dream, or something's really wrong. And we're talking about a psychiatric condition of some sort.
There you go.
Is your mic?
Yeah, we got a
That
mic
we
for
should
you.
have, I think I'm loud enough, that we should have between 7 and 8 hours of sleep. I
Well,
mean, because, you feel bad if a doctor says you should have that many hours and you're having less,
keep in mind this is an average that people worked up. And it's probably pretty accurate. It's very accurate. But it may not be accurate for every single person.
Or age bracket.
Or age, yes. A baby and a toddler, toddlers sleep 10 hours, don't they? Mine does. So, that's them. They exert a lot of energy. They need to build, building their bodies. You're 79, 80 years old. What are you doing now? Maybe you just don't need that much sleep.
should we avoid a nap if we feel like we need a nap during the day? Should we just avoid getting...
Well, if we can go back to Europe, they nap all the time. It doesn't seem to faze them. And I find naps, I wish I could do a nap every day, but I can't. Seems to be pretty good. Now, I worked with a company where I trained for my biofeedback certifications, and they actually had a little trial going on of napping. They used the employees as the subjects, and it was a big facility. And they set up a room with lounge chairs, and they said to the people, they just said, go take a nap if you want. And I think what they try to do is get them to take 5-10 minute naps. And they were recording how they felt. It wasn't particularly a deep study, all right, not a lot of detail. But how do you feel? When you go back to work, do you feel more productive? Were you bottoming out when you took that nap? And, was 10 minutes enough? The whole thing. 10 minutes is a pretty interesting number. It seems like people bounce back quite well. And it doesn't. And by the way, they also asked, did it disturb your nighttime sleep ever? Every day. So napping could be a good thing. Anything else? Yes, in the back.
So do you recommend? Okay.
Go ahead. I'll try to repeat.
Do you recommend the magnesium with the tryptophan to help sleep?
Do I recommend magnesium with?
With the tryptophan?
Sure, you could do that. There actually is no combination. You wouldn't want to do tryptophan and 5-HTP because they're the same category. If you're not in the same category, there's no reason why you can't use 2 or 3 of these things. But you don't want to do tryptophan, 5-HTP, and maybe melatonin. Those 3 things would have to be dosed down to do them, or you might get yourself way too tired and you might have a hangover when you wake up. So you have to be careful. There are combination products out there. I don't think there's a single one that does 5-HTP and tryptophan. Any other questions?
So, is there like a blood test that will give us guidance on what supplements to take?
Would it be like a blood test, a CBT, that would give us guidance on what supplements to take?
I think generally no. You could do an amino acid test or a neurotransmitter test. Could tell you some information. Like, do you have normal GABA? Do you have normal acetylcholine? But even that may not answer the question, because you could add GABA and get a good night's sleep. You have normal GABA. It may be stress that's causing it. There may be nothing in your blood or in your neurotransmitters that indicate that. So it's not an easy thing. It's very difficult. So a sleep practitioner needs a good history better than blood work and things like that. Anybody else?
I'm curious of your what your feelings are about meditation and how that helps with sleep.
Well, medication will put you to sleep.
Meditation.
Oh, all right. Now we're talking about something totally different. So meditation, to me, is just an enhancing of the breathing technique. Stress reduction, breathing technique. It's exactly what you need for sleep. If you're a good meditator, you're probably going to turn yourself into a good sleeper if you do it right. Oh, I woke up. Yes, meditation is a great thing. The breathing technique is very important. To the extreme hypnosis. Teaches you how to go into a trance. And what are you doing in meditation? You know, you see these drum circles where they sit around. And what are they doing? They're putting themselves in a trance. When you listen to music, certain types of music, you're putting yourself into a trance. Now, this is weird. I had a lot of trouble sleeping when I worked for Bucks County Community College because I would have very late hours. I was on the administration, but I had to be there for the night school. But we were very short on people, so I'd be getting in 8 in the morning and working till 11 at night, especially during registration that whole month. It was very difficult for me. And I would go home and I couldn't sleep. I was wide awake, and I had this little FM AM radio, and I would turn it on to, I forget the station, and it was it was a very programmed station. The same song came in at the same time every night. So, everybody know Donovan? Okay. So, he had this song called Hurdy-Gurdy Man. And I knew it would come on. Just when I would lay down, maybe 5 minutes after I lay down, I never heard the end. It crashed me every time. So certain things work like that. It put me in a trance, out cold. I think my mother would say she would come in at 3 in the morning and shut the thing off, that kind of thing. Actually, I think it was my father when he woke up to go to work, he would shut it off, and once in a while they'd mention it, but who cares? It didn't wake me up, put me to sleep. But that song had some magic to it. And I have a hard time listening to it ever again. Okay, any other questions? Oh my, okay.
So I went like 3 days without sleeping.
Yikes.
Couldn't figure out why. But the product that I'm using right now is called Deep Sleep.
Yes.
It's a supplement, and it helps me to sleep. The only thing is it doesn't give me 8 hours of sleep, and my sleep doesn't feel really rested. So I am interested in the product that you have there, the one that's a mind and blood barrier, the one that's
that might be a good cushion. You might need to get away from what you're trying to do or cut the dose down. You might add glycine as a base so you stimulate more GABA. Glycine could be a big help. Inositol. You're going to have to experiment. It's going to be a little complicated for you.
So are you suggesting the deep sleep along with the glycine and the...
I think I'd get rid of the deep sleep, try something different.
Okay.
Your body might feel a lot better switching.
Okay.
Sometimes when you use the same thing all the time, you don't get the effect. Very often people tell me, the first 3 nights I slept like a log. And after that I kind of went back to my old problem. Well, the body, this is a habit, and it's hard to break a habit. So sometimes your body wants to go back to the old style once it gets used to the new product you introduce. But glycine is kind of it's the core of the bottom. You're loading glycine in, then you add a little melatonin, or you add GABA, or you add L-theanine or magnesium. You might get a much better result. You've got to start scratching and trying other things. Okay, nobody left so far. That's surprising. Must have had a good session. Anybody else? Question?
Yeah, I have neuropathy in my feet, and just the last couple nights I cannot sleep. It's just like shocks every few seconds.
It's a pain syndrome.
And it keeps me awake. I have a sleep problem anyway, so would you suggest anything specifically?
Well, neuropathy is a tough one. You got to fix the neuropathy, or try to do something for the neuropathy. We're big on alpha-lipoic acid and benphthiamine. That's another lecture. But we have it. That will start to change that a little bit. Takes some time. You might also be a good candidate for riboflavin. That might have an effect on it, might not, but it might be worth a try. So that may be where you start, and then maybe work with inositol or taurine and see if you can't get yourself to better level of sleep. You've got to stop the pain. You've got to stop that neuropathic discharge, I guess you call it.
Well, they gave me this nerve.
Yeah, that's a possible good candidate, but they don't work overnight.
No, they don't.
You've had neuropathy for a long time.
Right.
It took a long time to get there. It's going to take a long time to go the other way.
Right.
Okay, are we good? So we got a whole lot of products for you to think about with sleep. I'll be here for the rest of the afternoon, and you can ask me any question you want. I won't run away. Well, maybe I will. I'm very hungry. I haven't had lunch.
Can I just say something before we all go? Dr. Phil, thank you very much for this lecture. It was very informative, very authoritative, and I'm sure we've all been well benefited by it.
Well, thank you, David, even though we're friends. I accept that.